So Henry Ford's Model T was the 20th version of the car that he built, and Unfrazzle is the 20th version of the product stream that I've been on for the last 8 years. So I'm going to tell you a little bit about some highlights from this long, strange trip. It started off in 2006 with the sketch on the right over there, and a series of products from Zume Life, and then an app called Tonic, and now Unfrazzle, all focused on the simple idea of how do we make it easier for people to remember and keep track of their care tasks, what healthcare calls adherence. From the beginning, we decided that to focus on disease was nonsensical because people have multiple diseases, chronic as well as non-chronic. And so it made more sense to focus on activities, the things that we do in common, no matter whether you have diabetes or a sprained ankle. Sort of these buckets of medications and biometrics and therapies and symptoms and so forth. And it made sense at the start, but then we ran into real users. And we quickly discovered that many things don't fall conveniently into buckets, and really started questioning the idea of buckets itself, which then led to a lot of design innovation that showed up in Tonic and Unfrazzle, where there are no buckets. It supports you doing whatever you do. We also discovered that people do all sorts of stuff that they include as part of their care regimen that we as product designers would never have thought of. And it really established sort of very firmly the idea that only the user is in charge of what's in their care regimen. We also had some pleasant surprises, like the damn idea worked. Sharia was one of our earliest users using a Zume Life system for measuring her scleroderma, her pain, and her medications and so forth. And initially, she started using it. To her surprise, she found she was recording 4 to 5 serious episodes of pain. But then basically titrating on her medications, the times and the amounts, she was able to reduce it down to 1 mild episode. And it was critical that she had a tool for both the recording and the remembering. A very strange outcome was that people told us they loved the tool. And we would go analyze the data of tool usage and found out, well, they weren't really adherent to the tool, so what's going on? And it turned out that they put much, much higher priority on the doing than the tracking. So oftentimes, if their health was stable, they wouldn't bother recording any information. They would just use it for the reminders. And this turned out to be really, really important insight. The other thing that was also a conundrum was that initially people would tell us, I mean, quite literally, that they felt a weight lifting off their shoulders. There was enormous decrease in mental stress from not having to remember and track and so forth. But then often when we would check in with them weeks or months later, we discovered, well, they weren't using the tool that often. They had somehow mysteriously discovered an innate ability to remember the minutiae in their lives without assistance. So we said, well, you don't have to have our tool anymore, give it back. And they refused. Basically, it was essential to their living. And they found that it was critical to have whenever they needed it, but it wasn't me to decide whether they were using it properly or not. And people prioritize living over managing health. Once I sort of solved the design problem from my perspective with Tonic, we turned to the next major issue, which is supporting us caring for others, not just ourselves, and quickly discovered that this terminology of caregiver and recipient, patient, loved one, etc., is a bunch of crap. Basically, our lives are much, much more complex. We're caregivers, we're care recipients, we're caring for many people, they're caring for us. There's all sorts of people involved, and it's constantly changing. So the design challenge was, how do we view things from the perspective of the caregiver, not the patient, and the whole supporting cast? Which led back to the drawing board, version 20 now, which is Unfrazzle. It's an app for iOS and Android. It helps you remember and keep track of anything that you decide is part of your care regimen, and to stay in touch with your co-caregivers. And it's completely customizable by the users. So the other thing to highlight in terms of using the Model T analogy, the Model T was a wonderful car. It got all the basics right, and I'm hoping Unfrazzle, is a tenth as good. But the key thing was the Model T was really simply the end of the beginning. We've had enormous improvements in cars since then. None of us would like the damn thing. And so I have at this point now 8 years worth of feature demands from users and many things that got left on the cutting room floor. The last thing to mention is the importance of coaching. Caregivers simply do not have the time to discover tools, to figure out which one's best for them, how to make use of it, and so forth. We have to have coaching services to help people find the tools and to use them and get them going in their lives. So, thank you.